All right. Hi, my name is Rhonda Reynolds.
I'm Dale Graham. It's a pleasure to be able to tell you guys about what we do for veterans and their families.
Dale and I are two of the founders of this organization. And one of the things we want to talk to you about is the availability of financial assistance. We always send people out for evidence, right, Dale?
Well, yes, when you talk about evidence, you talk about VA claims. If you don't have evidence, you don't have a claim.
Mhm.
And we kind of built our success on being able to assist veterans and their families with the evidence needed to support a claim. And a lot of times the veterans don't have the money to pay for that thing.
Well, and that's true. And it's not a lot of money, but the reason we do this, one of the many reasons we do this is offer the financial assistance because to many people, way too many people, the cost of an exam is a barrier to the assistant, is a barrier to the claim going through. Because like Dale said, you got to have the evidence. And if you can't pay for the evidence, sometimes people would just stop, and we didn't want that to happen.
Yes, we've kind of went in and we put a limit to what we could afford to put out and what we can afford to do. And we're not going to let nobody take advantage of us. There's always people that would try to take a nonprofit's money and do whatever they want to do with it. But we're kind of frugal. If you get anything past Rhonda, they needed it. So,
I wouldn't talk.
So the VA is going to submit, or likely going to send a veteran to a compensation and pension exam.
Yeah.
And that examiner is going to fill out a DBQ. Why do we send out veterans to an additional exam to fill out an additional DBQ?
Well, it works.
If you don't have a diagnosis of a chronic condition, the chances of VA approving that claim is really non-existent. There might be something out there, but you got to have a diagnosis. You got to have that stuff. The only time you can get by without that is if it's veterans retiring from the military service or leaving the service after they're on a clean discharge and stuff. They have 1 year from the date of the discharge to file a claim and not require any evidence other than their service medical records. But
too, that even though it's not a lot of money, some of our clients say, well, I've got a medical provider. I just saw my doctor for this. I'll just have them fill out the forms. And what do you think of that, Bill?
Well, I think probably, it's kind of, it's when most people, most providers are not familiar with a VA disability benefits questionnaire, and they're not, they're afraid to go out there and put it out like it is. I've seen private physicians go in there and do something about a person with a bad leg, and they're saying that the guy can move it 120 degrees. Well, in reality, it's stiff and it won't move at all.
And to the medical providers that we use are used to the audience, so to speak, of their report as the VA. And if you're just going to your private practitioner, the audience that they're writing for is for you as the patient and also the insurance company to make sure it gets covered. So just like Dale said, we want to have somebody be fighting for you, tell your side of the story, because the VA is going to do that. So we just kind of level the playing field.
Well, you have to, Rhonda. If you don't provide the evidence needed to support this veteran's or this surviving spouse's claim, you're really not going to. You've done them a disservice, and if we got people that'll help us, or organizations will help us to provide this service, then we need to do it. Most of that money comes from other veterans that we've helped. We're not funded by anybody. Nobody's taking care of us. But in the last 10 or 15 years that we've been doing this, that this money has came from other veterans that we have helped.
Do you remember when we used to have to pass the hat among the volunteers?
I did. I passed that hat. I know I came up short several times, but
you got enough money.
Who should apply for financial assistance?
That's a great question. Who should apply? Anybody who thinks they need it. We have a screening process, of course, just like Dale mentioned earlier. We can't just give it away to everybody, but if you meet the criteria, which we compare your income to your expenses, other factors that come into play, We even keep track of how much you've been provided and whether you actually went to get the evidence that we approved you for.